This video will cover mantle cell lymphoma. As an anchor, we're going to use this character here with a large blanket, or you could even say it's a large mantle. Mantle cell lymphoma tends to affect adults, and the prognosis is not great. To represent this, we have an adult character who is clearly not having a good time, and this should help us remember this. The tonsils are a common site to be involved by mantle cell lymphoma, and so is the rest of the GI tract. This is represented by this character with his tongue out, which allows us to see his tonsils. And of course, since the mouth is the first point of the GI tract, we're just going to use that to remember that the rest of the GI tract can also be affected. Take a look at this random weird nodule here in the mantle. That's actually pretty gross. Who knows what happened with this mantle? I don't want to know. This represents the fact that mantle cell lymphoma commonly has a vaguely nodular architecture. Since there is only one nodule on this whole mantle, we'll remember that it's just a vague nodular architecture. Two characteristic stains used for diagnosis are CD200 and CD23. These are expected to be negative. Although I do not usually create a prompt to represent negative stains, I think in this case it is valuable since these are so crucial for this disease. CD200 being negative is represented by our character's phone showing his account balance of -200. CD23 being negative is represented by the Tweety character on a tree because Tweety sounds like 20 and tree sounds like the number 3. And the fact that the birdie here is asleep is going to remind us that this stain is negative. Another stain that is positive and often used in the diagnosis is cyclin D1, which is represented, of course, by the bicycles in this image. On this topic, the translocation that is associated with mantle cell lymphoma leads to amplification of cyclin D1, which again can be remembered by not just one but multiple bicycles in this image. The translocation associated with mantle cell lymphoma is 1114 involving IgH and CCND1 genes. 1114 translocation is represented here by this familiar gas station, which doesn't its name sound a little bit like 11? And 14 is represented by the large bag of cash here, which you could say is a fortune. And fortune sounds like 14. Have you ever heard of a condor bird? It was a thing at least where I grew up. But in our case, this condor bird represents the CCND1 gene. Since there is one bird here, and you could kind of shorten condor to CCND. The chain on the condor is a special one because it's a real heavy chain, and it represents, of course, the IgH gene. Let's cover one last detail. A SOX11 stain can often be helpful in mantle cell lymphoma cases that have negative cyclin D1. The SOX11 stain is expected to be positive in these cases. I even included a reminder on the SOX here to help us remember that this is in regards to cases that have negative cyclin D1.